we can deal with this, okay? Because in my office, again, we are very preventative minded. We're prevention, prevention, prevention. We are active, being proactive instead of reactive. You know, the difference between proactive means jumping out on the problem long before it becomes a problem. Reactive is, oh my gosh, I've got the problem now, what do I do? Proactive, you can do something from a place of peace and stillness. Reactive is fear. Now, many people in this room already have lung disease, so the question becomes, well gosh, I've got the lung disease, am I now reactive? That all depends on your frame of mind, okay? Because we can be proactive in doing what we can to improve the quality of health from this day forward. So from now on, everybody in this room is proactive, okay? Proactive regardless of what you have. So let's summarize so far what you learned today. Michael Jordan played with me, okay? We learned today how stress is just a huge component of all that happens in our lives. And we also learned that inflammation is the key. Let's go and find out what we can do about this, okay? So, this is one of my patients. No, but I like this picture because, you know, we have in my office, I've started something new. We're the only office that I know of right now in the country where I have a gym in my office. I have 3 personal trainers. I have a 10-week medical fitness program. And this is a part of what we dispense. We dispense good old-fashioned physical activity. We have lectures that you can go to every single week, every Tuesday night. As a matter of fact, tomorrow night's lecture that I'll be giving is how to eat and lose weight at the same time. Did you know? I hate to digress, but did you know that if you eat broccoli, okay, eat a little thing of broccoli, okay, that broccoli has 25 calories in it, okay? But when you eat it, your body has to work to digest it. Your body burns 88 calories. So you take it in 25, but it takes 88. So you're going to lose weight just by eating that broccoli. Did you know that? And there are several other foods that are just like broccoli, that where you're actually eating it and you can actually lose weight by doing it. So these are some of the things we're going to be learning in the talk tomorrow night. But anyway, this is what we're doing in our office. Again, proactive. You guys are going to be one of the stars of our program in just a minute. Boom, there he is right there. And actually, you can go to our Facebook website, and you put in Mars Cardio Facebook, and you'll see this wonderful gentleman, Mr. Lassiter. I did this, you notice Mr. Lassiter's oxygen tank right there? I don't know if you can see that. And here's his little line coming all the way up to his nose up here. And we did this, I put this picture in during the Olympics. And so I put, "Go USA, demolish your obstacles." And so Mr. Lassiter, he and his wife started the program. And what we're seeing in our program is that when you have lung problems, like Mr. Lassiter, if you can get the rest of your body in good shape, then it takes the pressure off the lungs and it takes the pressure off the heart. Why? Because it helps your little red blood cell move through the cardiovascular system a lot easier. Does that make sense? Your buddy, you remember your buddy, the red blood cell? Okay, he's trying to do his work. And so what we're doing here is we're helping Mr. Lassiter to move that red cell throughout his system a little better. And he is doing wonderfully, absolutely wonderfully. I want to tell you a little bit about this thing called Tabata Training. Tabata Training. There was a gentleman, a Japanese gentleman, who trained speed skaters. And what he found that if he got his speed skaters to speed skate as fast as they could for 20 seconds, and then to rest for 10 seconds, and then speed skate for 20 seconds, and then rest for 10 seconds, and do this interval for a total of 4 minutes, it would give them the same workout and the same burn as if they worked out for an entire hour. And so 4 minutes it takes to get this. I want to introduce this to you because you can do this at home. Now, you would all start off, first of all, by getting more educated about Tabata, and I can't possibly give you Tabata 101 today, all right? But basically what you do is excellent indoor-outdoor activity. You're going to basically go in a 2-to-1 ratio. In other words, you're going to move fast for 20 seconds, and then you're going to rest for 10 seconds. Fast for 20 seconds, rest for 10 seconds. The goal is to do this for a total of 4 minutes, and you get an hour's worth of burn, or an hour's worth of energy, if you will, in kind of an afterburn. Now, does that mean that you have to go and speed skate? No, this is something you can do in your chairs, in any movement whatsoever. We don't like to use the E word in my office. Exercise? Ooh. Ugh, no, we don't like that. I like activity. Any kind of physical activity you can possibly get. I love chair aerobics. Chair aerobics is a very wonderful way of doing just this. And this just means when you're sitting in the chair, just simply moving your legs as fast as you can for 20 seconds, and then rest for 10 seconds. Now, for those of you, I would encourage all of you, if you haven't gotten a smartphone yet, at some point you're going to have to, because they're not going to be making the flip phones anymore, and they're not going to be making all the other ones. Eventually, everybody's going to have a smartphone. And the smartphone is revolutionizing the way we do everything. My mother's 85 years old. She has a smartphone. She bought a new laptop. She has a Facebook. And she is connected like you wouldn't believe. But there's tons of free stuff on your laptop, on your Facebook. Please get your children, your grandchildren, to get you hooked in line with a smartphone. At some point, turn your they call them the dumb phones. Turn those in and get the smartphone, or get a computer and ask somebody to help you get hooked up with a computer. Don't resist anymore, folks. You have the world's information at your fingertips, and you can learn more about Tabata Training. And this is what this gentleman right here is doing, Tabata. Okay. All right, let's talk about 9 keys to longevity, because this is what this gentleman that lived to 100. Have anybody heard of the blue zones? Anybody did see that National Geographic article that came out, special on the blue zones? I'm trying to create a little blue zone in my office. Now, there are blue zones all across the world, and these are places where people live into their hundreds easily. They're not in nursing homes. They're not sitting in rocking chairs and urinating on themselves and have to sit and all this kind of stuff. This kind of stuff that we see often. They are up, walking around. Their minds are sharp. They're crisp. This is the little old lady that's in the field just chopping away, just going. She's 105. And her main job is to go down and get the water from the river and to bring it back. That's all she does. That's all she does. But she's moving. We're going to learn how these people do it. So these are the areas across the world: in Costa Rica, Sardinia, Italy, in Ikari, Greece, Okinawa, Japan, and where in the United States? Loma Linda, California. Anybody know what religious group is in Loma Linda, California? The Seventh-day Adventists. And they have, their group of people live into their older years far better than the rest of the United States. So let's find out what it is that these people are doing. These are the 9 things, and we're going to go into this in more detail later on in my talk. These are the 9 things that they're doing, and not necessarily in this order. They're constantly moving, and they're not going to. There's not a Gold's Gym, okay, or American Family Fitness. It's just that their everyday life involves movement. They're sitting on the floor. They're getting up. They're going and they're working out in the fields. These kinds of things where everyday life is movement. In some of these places, fixing dinner, they're expending a tremendous amount of calories. They are grinding the meal themselves. They are going out and they're getting the milk from the cows or whatever organ. They are preparing the meal, so they can spend a tremendous amount of energy just cooking dinner. So finding a purpose. This is basically a reason to get up in the morning. It's so important. In my opinion, I think these 2 are probably the keys, the top 2. Slowing down. Again, that cortisol level, cutting it down. You know, vacations are so important. Spending time with the family. Yesterday, my family and I, we had a big family trip to the grocery store. We had to go to the grocery store. Nobody likes going to the grocery store. So what I told everybody, I said, we're going to take, instead of saying we got to go to the grocery store, usually I'll stop it to the kids. My kids are 22 and 17. I said, hey, we're going to take a family adventure today. And they were like, yeah? I was like, yeah, we're going to take a family adventure. And so we're going to go to the grocery store. We're all going to go, and everybody can chip in, and we can get in and out real fast. And then we're going to go and eat afterwards. Do you know we had a wonderful time yesterday? It was absolutely fantastic. So, again, just slowing down, jetting down. Stop eating at 80%. This is when you're 80% full. Can I get everybody to repeat this sentence? Put the fork down. Everybody, 1, 2, 3. Put the fork down. One more time. Put the fork down. Why do I say that? Because it takes 20 minutes for your stomach to tell your brain that you are full. Okay? Right? But a lot of damage can happen in 20 minutes, right? We all know the technique. We go get the food, right? And we stick the fork in the food, we twirl it around, we put it in our mouths, we chew, but we are loading up before, because heaven forbid that food go down and we don't get another one in there in time, right? So we load it up. Nobody does it better than my kids, by the way. And so load it up and we put it in, and we load it up and we put it in, and we never put that fork down. Oh my gosh, what would happen if we did that, okay? And so therefore that whole plate can be gone in 10 minutes. Right? That leaves 10 minutes left over. Your brain, the message still hasn't gotten up here yet, right? So what do? People laugh because they know I'm telling the truth. So I'm not going to ask. Okay. So what do? We go back to that second plate, right? Because we still haven't gotten the message yet. Right? And so we go back and get the second plate. Of course, the second plate's not as big as the first plate, but still, we sit down and we go, And then, of course, we have to have dessert, right? You gotta have dessert. And my wife and I, every Wednesday night is date night. And so date night, we can go, we eat out to dinner, we go to a new restaurant, we have anything we want. Anything we want, dessert, anything we want. And then all the rest of the days look pretty good. So we're constantly telling each other, put the fork down, put the fork down. Now, what do you do while you put the fork down? You're drinking some water, you're talking to the people around you, you're enjoying your company, you're jetting it down. And then you put the fork down, you chew your food, enjoy it, taste your food. And then once the food goes down, you pick the fork back up, put another one, and then what do? Put the fork down, okay? All right, so then gives your stomach time to tell your brain that you're full. But of course, by the time you had 2 plates and dessert, and then finally the stomach and the brain connect, and it's like, I was full a long time ago. And you sit there going, I ate the whole thing. I can't believe I ate the whole thing. Everybody remember that commercial? So that's what, stop when you're 80% full by putting the fork down. Eating plants, folks, enough said. If you see anything green outside today on your way out, take a bite out of it and don't ask questions, all right? Green is what, it's like electrons, energy from the sun, that photosynthesis. Take it in your body. I don't care what it is, just eat it. Not that plant over there because that's false, but if it's green, take a bite out of it and eat it. Red wine, I have to be very careful telling my patients to drink. But red wine has something called resveratrol in it. Resveratrol is a very potent antioxidant. You have to drink the whole bottle in order to get the power in one pill. I'm not encouraging that, okay? Everybody's glass is different. But, and also, I think part of the red wine is that it does help to relax you. It does help to relax you. So this is what they do in these countries. They join a group. You have that here. Spiritual activities, having a spiritual connection. And that is not necessarily in a religion. That's just something, being attached to something that's bigger than you, you know? And that could be your spiritual connection. And then finally, family first.